dramatic, I call it dramatic decision, Trump, and the operation of US.
Once you go down,
future of the
you must be
United
crazy if
States
you think
Agency
that I'ma
for
slow down.
International
Don't wanna hear it
Development,
talking shit for the
USAID,
drama.
is uncertain.
USAID, run by radical lunatics, and we're getting them out, and then we'll make a decision.
The agency employs more than 10,000 people, with about two-thirds serving overseas, according to a recent Congressional Research Service report. President John F. Kennedy created the organization as part of the Foreign Assistance Act of
Dropping bodies in the place till the sun's out. Can't fuck with this, I'm doing it private.
Yeah, a few years ago, I was involved in a few projects supported by USAID in several provinces in Indonesia, including in some regions, some significant cut to US involvement in international development aid in global south, including Indonesia. And as I have mentioned, it is a reality that we have to face and anticipate, and we need to adapt in the for at least 4 years under Trump administration. But as I have mentioned previously, this is of course a challenge, but we need to face it. We like it or not, we need to adapt. And perhaps this difficult situation can facilitate some lesson learned and some strategies to strengthen our national and also subnational capacity, not to be too dependent to international agencies like what we have experienced at least in the last 3 decades.
Yeah. But I think this also is like in a how can I say, coming from uncertainty also. I mean, in Indonesia, we are facing difficulties about the lack of budget for development, lack of resources to combat the disease, drug use, and so many problems with the environment, for example. As I've been through with the USAID, there's so many projects like for cacao, for renewable energy. How do you observe the possibility in the future? Is this like any option or a solution to, I don't know, to substitute or to have another opportunity with the international donors or agencies?
Yeah, I think development activities should go on and continue to be developed regardless the landscape of international politics. And one thing that we need to emphasize is the importance of efficiency in utilizing national and subnational resources. So 4 years, the next 4 years, we really need to be carefully observe the available resources that we have, and also the best way to manage it with the largest benefit for the people, the community. And in this kind of circumstances, careful planning and the importance of co-designing and co-developing to enable us to utilize the limited resources in the most efficient way is the key to survive. And in these circumstances, efficiency either in the national and subnational government, as well as an efficiency in the civil society organization should be emphasized. Good governance in all levels, in all institutions, can assist us to maximize the benefits that we can derive from this amid the changing global landscape.
Last I read from the internet, there are 5 big projects in Indonesia funded by USAID, and mostly their location mostly in the eastern of Indonesia. So I said that will be deteriorate. I use this term because of the there's no more support from USAID. There's no more continuation of the initiative. Do you have any specific notes about in Eastern Indonesia in terms of development or challenges for the future?
Yeah, for sure there will be a kind of significant shock in the first
Significant subs. Okay. Mhm.
first few months or the
Uh-huh.
first 1 or 2 years. But as I have said, regardless the dramatic changes in the global landscape, we need to adapt. We need to survive. So
Mhm.
I believe we are not passive agents. Those who are highly committed to continue development activities, including in the eastern part of Indonesia, will try to seek some feasible alternative in adapting and continuing some strategic development issues such as health and also now increasingly the interplay between climate crisis and health because these are the challenges that increasingly burden many areas in the global south, especially in the global in the disaster prone areas like Indonesia and eastern part of Indonesia are a very good example of an area vulnerable for exacerbated impacts because of the intersection of climate-induced disasters with health issues amid chronic poverty.
Yeah. Poverty is the main issues to be taken. For comparison between the budget allocation, between Australia and United States of America. In my opinion, USA is higher than Australian aid. Am I right? Am I correct?
It depends in which region. In some regions in Indonesia, particularly in eastern part of Indonesia, increasingly Australian aid are playing a more significant role. I think there are also a kind of communication between these developed
Mhm.
countries to better allocate the resources to avoid redundancy in some areas. So
Mhm. Mhm.
it is not very easy to determine who contribute larger because it is usually uh, also should be measured not just nationally but in each region who based on their collaboration and communication who should focus on this particular region and in which area of development they should allocate their fund. So it is not a matter of who contribute larger in terms of the volume of funding, but it is more relevant to discuss which country who contribute in particular area and in particular issues of development.
Yeah, Australian government and also United States of American government,
Yeah, Japanese
both
government.
concerned about Eastern
Yeah,
Indonesia, right?
yeah.
Yeah.
Japanese
Okay.
agencies or some other countries like in New Zealand or Canada or some Scandinavian
Yeah. European
countries also.
countries. Yeah.
And of
Maybe if you can define or determine some implication, yeah, for the Trump policies on the international program or their support to Indonesia, especially for Eastern Indonesia. Do you have any specific? What kind of implication? What are the implication, specifically, Sudi?
as I have mentioned previously, the significant cut will affect the volume of activities and also
Yeah.
the variation of programs that could be supported. We are going to face significant reduction in both areas, and as a result, we need to find or seek some alternatives of resources to continue at least some part of the most strategic issues that we should continue. And particularly in the coming few months, or let's say in the first 1 or 2 years, that will be a long and winding road, a very challenging time
Yeah.
to prioritize which area that we should focus, because we cannot do all activities that we wish to do amidst the limited resources. Our capacity to have a lesson learned to prioritize the most urgent areas of development that should be supported using the available resources, either from the national or subnational government, the most important strategy to survive amidst these dramatic changes.
Especially for the public health issues, maybe you may raise some things
Yeah.
or issues to be tackled in the future.
Yeah, I think health authorities in Indonesia should evaluate the programs that are supported by international agencies, particularly American-based institutions, and then to do a kind of strategic mapping, which area they are most urgent to be continued, and because of this significant reduction of fund from the U.S. Contribution, how to continue those prioritized area, how to fill the gap amidst the withdrawal of the U.S. based funding, how to fill the gap left by the Americans to continue this strategic program.
Cooperation, yeah, something like that. Okay. Sudirman Nasir, PhD, you are in Canberra right now. Before I close this online conversation, what are you doing there in Canberra?
Yeah, I'm currently doing visiting scholar program at the Australian National University in Canberra for 1 month. So yeah,
Wow, a
yeah,
month. Oh,
yeah.
okay.